Hi, I'm Jake Braford, and I'm going to now introduce you to the Certified Healthcare Builder Training and Certification Program. This presentation is meant for decision makers trying to decide if this program is right for them or their company, and it's also for newly enrolled students to understand what they're about to experience in these 6 modules. Why do we need additional trainings for healthcare renovations? There are some good options out there for infection prevention trainings. But many of them stop at that initial ICRA setup. Patient safety and infection prevention require much more than ICRA containment. Your ICRA can be perfect and patient safety can still be compromised. I had teams coming to me without a ton of healthcare renovation experience. I'd send them to these ICRA trainings. They'd ace that first week and they'd start asking me a ton of questions after that initial ICRA phase was done. So I believe this is filling in a big gap in healthcare renovations beyond just that initial ICRA phase. Also, we're in the midst of a huge construction labor shortage, and this is only going to continue and increase with the data center build out. This is going to result in less experienced workers in hospital renovations, which has a major threat to patient safety. The solution I came up with is the Certified Healthcare Builder Training Program. The target audience is for general contractors, construction managers, and trade contractor supervision. Also is going to be very applicable for healthcare owners reps, facilities personnel, program managers, and other healthcare professionals. The program structure for the program, it is a 6 module program centered around a sample project. Each module is going to include an hour-and-a-half presentation, assignments and quizzes to reinforce concepts from the presentation, and office hours to support trainees with the assignments and any difficult concepts that we went over in that presentation. Overall, the course has about a 20-hour time commitment over the 6 modules. It's going to be a little bit more for brand new to construction folks and a little bit less for those with a lot of experience. Over on the right side of the screen there, you have a snippet from the sample project. So the standard offering is going to have this sample project with is a 2-phased right size OR project, which we're seeing a ton of those around the country. So it's really there to introduce a lot of really good concepts that are going to serve trainees well in any hospital renovation that they go to. The standard offering. So this is what you would get if you hit the enroll now button to enroll in what's online. So you would get 6-week program centered around a sample project. So it'll be 1 module each week, an hour-and-a-half weekly pre-recorded presentation so that you could watch that presentation whenever you wanted during that week, weekly assignments and quizzes, and live weekly office hours to support trainees. There's going to be an AM and PM option available on Thursdays to make it work for various schedules and various time zones. Obviously, you don't pick the AM and PM, you'd pick whichever one you wanted. For this option, again, you can hit the enroll now button and sign up, and you'll be in the September-October class. The alternative group offering. So this is if you have a group of 5 to 10 individuals that you want to go through this training all at once. There are 3 main options here. You've got 100% live online options. So the main difference between that and the standard offering is it would still be a 6-week program, but instead of pre-recorded presentations, I would do those presentations live so that you could interrupt me at any moment and ask any questions that you want to, and we could answer them right then and there. There's a 1-week fast track option, of course, depending on availability, that you could do the module 1 in advance of that fast track week, and then modules 2 through 6, an AM and a PM session to knock out the entire course over a 1-week period. There's also a 2-day in-person option, similar to the 1-week fast track option. We do module 1 in advance of the fast track time, and we do modules 2 through 6 in a 2-day all day intensive training. For any of these options, please email me at jake@technicalbuilders.org to book. Going to give a brief overview of each of the 6 modules so you know what's coming. So module 1 is going to be an introduction to healthcare construction. It's going to be understanding the unique healthcare owner needs. We're going to review building systems most impactful to patient safety, and the assignment's going to be a self-review of MEP systems. Like most introductions, this stays fairly basic, but we've got to get everyone at the level for the much more highly technical modules 2 through 6. So for those that have done a ton of healthcare renovations, module 1 is going to be basic, but don't worry, it's going to get much more technical, much more interesting in modules 2 through 6. Module 2, it's going to be dedicated to infection prevention. We go through infection prevention in every module, but this one is dedicated to that initial ICRA setup phase. We're going to talk about the importance of infection prevention throughout the construction project, the overview of ICRA standards and ICRA plans, and we're going to do a deep dive on ICRA barriers, negative air machines, and best practices. The assignment's going to be to develop an ICRA plan, including drawings and calculations. That's going to be an ICRA plan for phase 1 of that 2-phase operating room renovation project. Module 3 is going to be cut, cap, make safe, and demolition. Infection prevention during this dangerous phase. As we're doing demo, we're stirring up a ton of dust, mold, viruses, bacteria. It's all going airborne. So it's the most dangerous phase for patients surrounding the area and for workers as well. We're going to go through pitfalls to look out for during cut, cap, make safe, how to make sure that we're not cutting off any live utilities, how to work through as we cut, cap, duct so that we're not overpressurizing duct somewhere or causing pressure relationships to fall off somewhere else on that air handling unit. We're going to go through communications and coordination with hospital during this very important phase. And the assignment's going to be to conduct a utility impact and phasing review on that sample project. So I've done a ton of phased renovation work. I've never been on one that did not have a significant MEP phasing bust. So the goal with this assignment is to train everyone to look out for those phasing busts before setting foot on the site so that they can be resolved well in advance of mobilization. Module 4 is going to be dedicated to architectural and structural systems in healthcare renovations. We're going to do a deep dive on fire and smoke ratings in healthcare construction, and going to present a ton of lessons learned with unique architectural and structural assemblies in healthcare. So no way we're going to touch on every architectural and structural assembly in healthcare renovations. However, over 55 plus healthcare successful renovations that I've done, these are going to be the ones that show up most consistently or the most problematic ones. The assignment's going to be to put together a corridor finish schedule and an RTU steel sequence, both in occupied areas or normally occupied areas. Module 5 is going to be a deep dive on MEP systems. So we're going to go over the basics of controls, air handling units, and other mechanical systems. We're going to do the basics of electrical systems and the all-important coordination studies and making sure that our breakers are set correctly to those coordination settings prior to energization. And the basics of plumbing and medical gas systems. The assignment's going to be to develop a detailed method of procedure for a new rooftop unit tie-in. Module 6, tab commissioning and turnover. We're going to go through infection prevention leading up to turnover. So much focus is put on that initial infection prevention phase towards the end of a renovation. People tend to be in a hurry to try to finish, and sometimes ICRA can get pushed to the side. So we're going to go over proper steps to properly work our way out of a construction renovation in a hospital so as not to impact patient care. We're going to talk about tab and commissioning. We're going to go details on tab because general contractors and a lot of mechanical contractor, at least the on-site foreman, on-site superintendents, may not understand TAB to the degree that we need to in order to help solve problems. And we're going to go over a ton of problem solving strategies, a lot centered around what to do when there's not enough air where you need it in a hospital renovation. The assignment on this one's going to be a final assessment. It's going to be a 30-question multiple choice test. The benefits of this training program. It's essentially a boot camp designed to train seasoned healthcare builders and builders new to healthcare to get them ready for their next renovation. The program does count for continuing education credits for the CHC and CHFM renewals. We are an ASHE preferred education provider. In addition, you get your own certified healthcare builder credentials and have the right to put CHB behind your name. We also have a customizable training program if you have a group of 5 to 10 all going to one renovation or a bunch of them going to one renovation. We can offer some customizations instead of that two-phased OR renovation project. We can cater the assignments to a project that you're providing. Qualifications of the trainer being me, of course. 15 years in healthcare construction, 19 total in the industry, all for national general contractors. I have over 55 successful healthcare renovation turnovers. In 2025, I was not one of 7 nominees for the HCA Construction Partner. Success in 12 healthcare facilities across 6 Virginia-based healthcare systems. How to sign up? If you want the standard offering, click the Enroll Now button on the preview page. If you'd like one of the alternate offerings for groups of 5 to 10, please shoot me an email at jake@technicalbuilders.org or give me a call at 804-241-4272. Thank you for your time. Feel free to reach out with any questions and would love to connect with you. Thank you.